Good morning, students. Today we are having lecture number 14. Today we are going to study viruses, and the first lecture that's about viruses is about viruses that cause respiratory diseases. You remember previous semester we studied general structures of viruses. We studied classification of viral infections and stages of viral infection. But now we are going to talk about properties of every virus, cause disease, pathogenesis, and diagnosis. So our lecture is called Causative Agents of Viral Respiratory Diseases, and today we will discuss some viruses that cause respiratory infections. These are influenza virus, parainfluenza virus, measles, mumps, rubella virus, adenovirus, and coronavirus. And the first virus that we will discuss is influenza virus. We will talk about morphology and structure of influenza virus firstly, antigenic shift and drift. Pay your attention that we talk about viruses not like we talked about bacteria. You remember that we discussed bacteria in 3 points: biological properties of bacteria, then epidemiology and pathogenesis, and then microbiological diagnosis, treatment, and prophylaxis. Viruses are distinguished from bacteria, but viruses are non-cellular microorganisms. They don't have cell organization, they don't have cell membrane, ribosomes. That's why they are lack of some properties, some structures. That's why some properties. Influenza virus belongs to family Artamyxoviridae. Pay your attention that in viral families their names are finished in virida. In bacterial families it finishes in sea. Family Artamyxoviridae, genera influenza virus, and there are 3 types: influenza virus type A, influenza virus type B, influenza virus type C. They are distinguished in their source. Type A may be transmitted from both human and animals, for example, pigs and birds. Type B only from human, type C also only from human. Influenza virus is a causative agent of influenza, so Latin name of this pathogen is influenza virus, name of disease influenza or flu. Firstly, about structure, about morphology of this virus. It is enveloped virus with hemagglutinin and neuraminidase spikes. You remember that there are enveloped and naked viruses. Enveloped viruses have both capsid and supracapsid. They have, or it's also called envelope. Envelope, you can see it on this diagram. Envelope. And they have spikes, hemagglutinin, and neuraminidase. This virus is frequently spherical, and it has helical symmetry. Helical symmetry, we may segment it into 4 parts through the center. It is called helical symmetry. Spherical viruses have helical symmetry. It is RNA negative virus. It has RNA negative chain, and it has some antigens. There are internal antigens and external antigens. Internal antigens includes matrix and RNP, it's a ribonucleoprotein. It is a nucleic acid RNA. These antigens are type-specific proteins, and they are used to determine whether a particular virus is type A, B, or C. They are specific for type. Type A has their own internal antigens. Type B has another internal antigens, and type C also distinguished from type A and type B. External antigens includes hemagglutinin and neuraminidase. We have started to talk about them. They are subtype and strain-specific antigens. Subtype and strain-specific antigens. For strain H1N1, for example, H2N2, H3N2. What do these numbers mean? In one type, for example, in type A, influenza virus, there are some strains that are distinguished in structure of hemagglutinin. All they have hemagglutinin, but they distinguished in structure of this hemagglutinin and in structure of neuraminidase. That's why they are called by different numbers, H1, H2, H3. This hemagglutinin is distinguished. Or N1, N2, for example. It's a different structure of neuraminidase. What about hemagglutinin and neuraminidase? These are very important antigens, external antigens of influenza virus. They are glycoproteins, and they have an important role in pathogenesis of influenza. The first one is hemagglutinin. It provides viral attachment on human epithelial cells, then promotes fusion of the envelope of the virus to the cell membrane of the host, and hemaggglutinates or clots human red blood cells. Attachment, then fusion with the host cell, and agglutinate red blood cells in human organism. Another one is neuraminidase. Neuraminidase cleaves the sialic acid on glycoproteins of host cells, including cell receptor. So it provides destruction of mucosal cells in nasopharynx, for example. It prevents clumping and facilitates release of virus from infected cells. So it provides spreading, neuraminidase provides spreading of viruses within the human body. I have just said that external antigens like hemagglutinin and neuraminidase are specific for strain. H1N1, H2N2, new strains of influenza virus are formed constantly because hemagglutinin and neuraminidase change their structure. Which processes provide changing of antigenic structure of influenza virus? There are two processes that provide mutations. Antigenic drift and antigenic shift. The first one is antigenic drift. It occurs due to mutation. Both hemagglutinin and neuraminidase after a few years may accumulate changes in viral genome and form new viral strain. Antigenic drift results in sporadic outbreaks and limited epidemics. So, antigenic drift is caused by mutation in nucleic acid in genes that express hemagglutinin and neuraminidase. So after some years, when these changes are present during a long period, after some years, it causes change in structure of hemagglutinin and neuraminidase. That's why new strain is formed. It causes outbreak in local, in region or in country, or limited epidemic, short epidemic. Unlike another process that is called antigenic shift, it occurs due to reassortment, when two different strains of influenza virus combine to form new subtype. As a result, the population has no immunity completely against the new subtype. Antigenic shift results in an epidemic or pandemic. You remember that epidemic infection is infections that acquired by lots of people in short period. It's present in regions of one country, or it widespread in some countries. But pandemic is infection when all countries are infected. People in all countries are infected. So antigenic drift creates influenza viruses with slightly modified antigens, hemagglutinin, neuraminidase, while antigenic shift generates viruses with entirely new antigens. That's why people has no immunity to new subtype. I will tell you that after influenza in patient, immunity is formed, lifelong immunity, but it's immunity to strain, to certain strain, but these strains change. That's why people are infected by influenza virus a lot of time during their life. You can see in this picture example of antigenic drift that occurred due to reassortment of two different influenza viruses, for example, human influenza virus and chicken influenza virus. When they enter in lung cells together, then present segments of RNA reassorted there, and new strain is formed. It's transmitted to another person, from one person to another person. So people don't have immunity, have no immunity. It causes pandemic. That's why this pandemic killed a lot of people. Pandemic of influenza killed a lot of people. What were this pandemic? The first known pandemic of influenza virus was in 1918. It was caused by strain H1N1, that was called Spanish influenza or Spanish flu, that killed from 20 up to 40 million people. Then there was pandemic of Asian flu H2N2 that killed about 1-2 million people in the world. After that, pandemic or epidemic of Hong Kong flu H3N2. Then H1N1 recovered once more, but it didn't cause pandemic because some people had immunity. In 2006, there was pandemic of strain H5N1 that was also avian flu. It caused severe pandemic. You don't remember, but I remember it. I remember this pandemic in the world. And in 2009, H1N1 caused swine flu. Maybe you remember when all countries controlled it's spreading, it caused mild pandemic. What about cultivation? Firstly, you remember that viruses are not cultivated in nutrient medium completely. No one nutrient media is used for cultivation of viruses. Why? Because viruses are intracellular obligate parasites. They can live just in living host cells. They need living host cells. Viral cultivation procedures take from 3 up to 10 days. They are cultivated in embryonated eggs. You can see we can inject it in yolk sac or in embryo or in amniotic cavity. Another method for cultivation is using of primary monkey kidney cells or other cell lines, HeLa and HEP2. Epidemiology and pathogenesis of influenza. The source of influenza are human or animals, pigs, for example in swine flu, or birds in avian flu. It's spread by airborne transmission via small particle aerosols or contact with contaminated hands or surfaces. The incubation period is about from 18 up to 96 hours. It's short. In most cases, it's short, about no more than 1 day. Target cells for influenza virus are epithelial cells of respiratory tract, trachea and bronchi. Pathogenesis. Viruses, influenza viruses, reach lower respiratory tract, attached to sialic acid on epithelial cells by hemagglutinin. You remember hemagglutinin provides attachment. Neuraminidase of the viral envelope may act on the neuraminic or sialic acid in mucus to produce liquefaction. Neuraminidase destroys sialic acid of the mucus, and this liquefied mucus may help spread the virus through the respiratory tract. So neuraminidase provides spreading of the virus within respiratory tract. Infection of mucosal cells results in cellular destruction of the superficial mucosa. So mucosal membrane of upper respiratory tract is destroyed by influenza virus. The resulting edema and mononuclear cell infiltration are accompanied by local symptoms: non-productive cough, sore throat, and nasal discharge. These symptoms appear because of cellular destruction of mucosal membrane. And there is edema, that's why it causes nasal discharge. Then, after local symptoms, we can see systemic symptoms. When viruses spread in the bloodstream, their destruction by immune cells cause intoxication. So these systemic symptoms are fever, muscle ache, headache, and general prostration due to intoxication. Another main thing in influenza that infected people are predisposed to bacterial superinfection because of the loss of natural barriers and exposure of binding sites on epithelial cells. Mucosal membrane is destroyed, so it resembles wound, and any bacteria that enter this site can cause infection, can cause pneumonia, for example, in the lungs. That is caused by bacteria of normal microflora in nasopharynx by Staphylococcus or Streptococcus. What about immunity after disease? It is lifelong, but is subtype specific or specific to strain. I have said about it that because due to changes, due to mutation, influenza develops immunity, but it is immunity to subtype. So the patient may be infected by influenza a lot of time during his life or her life. Microbiological diagnosis, treatment, and prophylaxis of influenza. Specimen. Specimen is collected from nose and throat. It may be serum for serological tests and blood because the influenza virus spread in the bloodstream. The first method for diagnosis is PCR. It's one of the most used. The next one is a detection of antigen, detection of viruses in specimen by immunofluorescence test. What is it? We collect specimen, and we add fluorochrome labeled antibodies. You remember we studied immunofluorescence test in immunology, and we may use commercial serum or diagnostic serum that is labeled with fluorochrome, like fluorescein. Antibodies. If influenza virus is present in specimen, antibodies bond to influenza virus, and then in fluorescence microscope we can observe that infected cells, infected human cells, have fluorescence, green color fluorescence, green color brightening. The next method is serological tests that is used for detection of antibodies in patient serum. We can use hemagglutination inhibition test, neutralization test, ELISA, and complement fixation test. The third one is a cultivation of virus. It's the third method, or method of viral isolation in cell culture or chicken eggs. We should inject specimen into chick embryo, and after some time we should detect the presence or absence of virus there. Identification of influenza strain and type in cell culture or chicken egg is made in hemagglutination inhibition test. Once more about cultivation of virus in chicken eggs. In the first step, we should inoculate specimen into chick embryo. On the second step, after 1 week, we should collect allantoic fluid from chick embryo, and this fluid from amniotic or allantoic cavity of chick embryo is tested for the presence of newly formed viruses by hemagglutination inhibition test. The virus in positive fluids is then identified by hemagglutination inhibition test with specific anti-sera. What about prophylaxis? Sure, there is a widespread prophylaxis of influenza virus. The vaccine is multivalent, and the current one is two strains of influenza A and one of influenza B. So vaccines consist of antigens of some strains and some types of influenza A and influenza B. There are some types of vaccines against influenza. Live adenovirus vaccines, split vaccines that consist all viral antigens, they don't consist living cells, and subunited vaccines that consist hemagglutinin and neuraminidase, main viruses causing disease, H1N1, H3N2, and type B influenza. These vaccines are widespread used in prophylaxis of influenza. In Russia, for example, influenza epidemic starts about in November. That's why in October doctors recommend to be vaccinated against influenza. What about treatment? For treatment of influenza, we may use antiviral drugs. For example, it's M2 inhibitors like amantadine and rimantadine for influenza type A, and M2 it's inhibitors of M protein, internal antigen, and neuraminidase inhibitors that inhibit neuraminidase, it's zanamivir and oseltamivir for influenza A and B. We also may use interferon. Maybe remember from immunology that interferon is a cytokine, non-specific protein that is produced in viral infections, influenza, interferon alpha, beta, and gamma. In influenza virus, we use interferon alpha because it's antiviral protein. Interferon is non-specific antiviral glycoprotein cytokine that's produced by immune cells. What is action of interferon? It inhibits viral replication within the host cells, activate natural killer cells and macrophages, and induce the resistance of host cells to viral infections. So everyone may use interferon for prophylaxis of influenza. It is sold in pharmacy. It's using paranasally. We should drop it intranasal, because portals for entry of influenza virus are nasopharynx. Another virus. We have just said about influenza virus. Now another one. It's a family Paramyxovirida, and we will talk about Morbillivirus and Paramyxovirus. Family Paramyxovirida, and there are two genera here. Two genus here. The first one is Morbillivirus that cause disease Measles, and another one is Paramyxovirus that cause such diseases as parainfluenza and mumps. These viruses, Morbillivirus and Paramyxovirus, belongs to one family, so they have the same structure of virus. Paramyxoviruses include the most important agents of respiratory infections of infants and young people as a parainfluenza virus, as well as the causative agents of the most common contagious disease of childhood, mumps and measles. Mumps and measles are mostly child's disease. Structure of paramyxovirus. These are large pleomorphic virion. Pleomorphic means maybe spherical or ovoid, but it's frequently spherical. Helical symmetry because it's spherical. It has a negative RNA genome. Envelope of the virus contains viral proteins or antigens. It's hemagglutinin and neuraminidase like in influenza, and they also contain fusion protein. It induces cell-to-cell fusion with formation of multinucleate giant cells. Paramyxovirus penetrates the cell by fusion with an exit by budding from the plasma membrane. In this diagram you can see structure of paramyxovirus. It has hemagglutinin and neuraminidase spikes. It has fusion protein that it's smaller than hemagglutinin neuraminidase. It provides fusion to host cells. Nucleocapsid that consists of RNA and matrix protein is present little bit. How can we cultivate? For parainfluenza and mumps viruses, so for parainfluenza can be cultivated in monkey kidney cell line and human epithelial cell culture. For measles virus, morbillivirus, we can cultivate it in monkey or human kidney cell or lymphoblastoid cell line. Epidemiology and pathogenesis of the first disease, that is mumps. Another name of the mumps is epidemic parotitis. Epidemic parotitis. Epidemic because it causes epidemics. Parotitis because there is a main clinical manifestation of mumps. It's enlargement of parotid glands. Mumps is caused by parainfluenza virus. Genus Parainfluenza virus. The disease reaches its highest incidence in children in age from 5 up to 15 years. The source of infection, the source of mumps are sick humans, sick children. Transmission ways, direct contact, airborne droplets or objects contaminated with saliva. For example, toys in kindergarten that are contaminated with saliva because saliva contains large amount of viruses. Pathogenesis of mumps or epidemic parotitis. Incubation period is long, it's commonly from 18 up to 21 days. The virus travels from the mouth to the parotid gland and it causes swelling of parotid glands there. In the parotid glands there is a primary multiplication of virus and then it causes generalized viremia when viruses enter the bloodstream. Then they reach testes, ovaries, pancreas, thyroid, or brain. Viruses are located in such organs as testes, ovaries, pancreas, thyroid, or brain. The swelling that results from mumps or orchitis in testes may cause sterility in men. If a boy is infected with mumps in childhood, in pubertad period, when he is infected, it may cause sterility then. But this complication is not so frequent. Maybe you could see it in some films. It's not so frequent. It's no more than 5% cases. Immunity is permanent after a single infection virus and it doesn't exhibit significant antigenic variation. So there is lifelong immunity after mumps. In this case, in this diagram, you can see main clinical manifestation. It's enlargement of parotid glands. Sometimes we can see it's from one side, sometimes from both sides. It occurs because of multiplication of virus there. The another disease that is caused by parainfluenza virus is parainfluenza. Name of disease is parainfluenza. Parainfluenza viruses are ubiquitous or widespread and cause common respiratory illnesses in persons of all ages, from small children up to young men and adult person. Unlike measles and mumps viruses, parainfluenza viruses rarely cause viremia. Viruses almost don't spread in the bloodstream, they don't reach bloodstream. The infection may involve only the nose and throat, resulting in a common cold syndrome. Common cold syndrome is characterized by coughing, runny nose, sneezing. It's a mild infection. But infection may be more extensive and may involve the larynx and upper trachea, resulting in croup. Another name of the croup is Laryngotracheal Bronchitis, when some organs are included in inflammation in infection process. What are these organs? Larynx, trachea, and bronchus. So some part of upper and lower respiratory tract. The infection may spread deeper to the lower trachea and bronchi, culminating in pneumonia or bronchitis. pneumonia or bronchitis. So appearance of infection depends on localization of parainfluenza virus. Immunity in this infection is short-lived. And the next disease that is caused by viruses from this family is measles. Measles is caused by Morbillivirus. Incubation period of measles is about 10 days. Virus enters the respiratory tract, multiplies there, cause viremia in the blood when viruses reach the bloodstream. It persists in the blood and nasopharyngeal secretions. So virus is present in the blood and nasopharyngeal secretions. Then another main manifestation of measles occur. It is the rash. The rash develops as a result of interaction of immune T cells with virus-infected cells in the small blood vessels. When T cells, cytotoxic T cells, CD8 cells, I hope you remember from immunology, cytotoxic CD8 cells release cytotoxic substance outside to kill virus-infected cell. It happens in small blood vessels, so it causes destruction of endothelial cells and blood vessels and causes rashes. And it lasts about 1 week. After 2 days of the disease, we can see another main clinical manifestation of measles. It is Koplik spots. Koplik spots are vesicles in the mouth. So we can see firstly Koplik spots, then we can see rashes. Involvement of the central nervous system is common in measles because the virus reach organs of central nervous system. And sometimes it causes transplacental transmission of the virus. After measles, the children develop lifelong immunity. In this photo, we can see Koplik spots. These are vesicles on the tongue and in the mouth. It's formed on the second day of the disease, almost immediately after the first clinical symptoms. And this in this photo we can see rashes in measles. Once more rash occur due to activation, due to interaction of CD8 T cells with infected human cells, and it occurs in blood vessels. That's why we can see rashes. In measles, sometimes there are complications very severe complications that is called subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis, or its short name as SPE. It is a generating disease of the central nervous system caused by persistent measles infection. It is late neurological sequelae of measles, or neurological complication of measles that affects the central nervous system. I have said in pathogenesis that virus also reach central nervous system. It may locate there. That's why it causes subacute sclerosing panencephalitis that is characterized by development of behavioral and intellectual deterioration and seizures after many years, when the child is not able to live as other normal healthy children, when we can see direct destruction of nervous cells, and there are problems in behavior of the child, in orientation, intellectual problems. What about microbiological diagnosis, treatment, and prophylaxis of mumps, parainfluenza, and measles? Specimen. Specimen depends on the virus. In mumps, we can collect saliva, cerebrospinal fluid, and urine. In parainfluenza, nasopharyngeal swabs, lower respiratory tract specimen, for example, bronchoalveolar fluid. And in measles, we can collect nasopharyngeal and conjunctival swabs, blood, and respiratory secretions. Which methods are used for diagnosis? It's PCR, then antigen detection by immunofluorescence test. I have said about it in influenza virus. We can collect commercial serum that is labeled with fluorescence dye, and we can detect viral affected cells. We may also use isolation of virus by cultivation of virus in cell lines in tissues, and serological tests like ELISA. Prophylaxis of these diseases may be done. We have vaccines against measles, mumps, and rubella, but we have no vaccine against parainfluenza. So in parainfluenza there is no any vaccine that may be used for protection. In measles, mumps, and rubella, we use combined live vaccine that is called MMR, measles, mumps, rubella vaccine. Remember please that this vaccine is used in all countries from age about 1 year. In all countries of the world, MMR vaccine is used. And there is a vaccine that protects only measles, live attenuated measles viral vaccine. It's used just against one disease. In most countries we use MMR vaccine. Treatment. In parainfluenza we may use antiviral drug ribavirin. In mumps and measles there are no specific antiviral drugs. There are no specific antiviral drugs that affect viruses. We may use just drugs to remove symptoms, remove high temperature, for example, but no specific antiviral drugs. Another respiratory virus is Rubella virus. It belongs to another family, Togaviridae, genera Rubivirus, and disease that is caused by this virus is named Rubella. Sometimes in some textbooks they call it German measles or 3 days measles. But it's not measles. It resembles measles in rashes, but these are different diseases. Rubella is one of the 5 classic childhood diseases. Rubella, meaning little red in Latin, was the first distinguished from measles and other same diseases by German physicians. Thus, the common name for the disease, German measles. That's why it is named German measles. It was identified there. Maternal rubella infection has since been correlated with several other severe congenital defects. This finding prompts the development of a unique program to vaccinate children to prevent infection of pregnant women and neonates. So we have already said about MMR vaccine. It uses in all countries. It is used in all countries. That's why it have a great role. It has a great role in prevention of spreading of rubella. Rubella virus. Rubivirus. It's enveloped virus, RNA positive, unlike influenza virus, parainfluenza, and morbillivirus that are RNA negative. There is only one major antigenic type. It is not changed. It is constant, so we can make conclusion from it that there is level on community. Nucleoprotein of the virus bound to the capsid. Here, the glycoprotein of the supercapsid shell is present. Glycoprotein. Its envelope. These are glycoproteins. It is a positive RNA chain. Cultivation of rotavirus. We may use various cell lines of monkey or rabbit. Rubella produces a rather inconspicuous cytopathic effect in most of the cell lines. Cytopathic effect means destruction or disruption of cells that are used for cultivation. Epidemiology and pathogenesis of rubella. Source of infection are sick humans, sick children mostly. Transmission ways are airborne, spread via aerosol route through infected droplets, or from mother to fetus. Remember please that rubella is a virus that also may be transmitted from mother to fetus. Incubation period of rubella is from 12 up to 23 days, average at about 18 days. Replication of rubella virus occur in epithelium and lymph nodes of the upper respiratory tract, leading to viremia and spread to other tissues. So, virus enters the human organism, infect epithelium, spread to the lymph nodes of upper respiratory tract, then virus enter the bloodstream from lymph nodes and spread to other tissues. Because of multiplication of virus, because of replication of virus in lymph nodes of upper respiratory tract, we can see enlarged tender lymph nodes that usually develop on the 4-6 day before rash. And there is another main manifestation of the rubella. It's maculopapular rash. Maculopapular rash that begins on the face and lasts from 12 hours up to 5 days. In this photo, we can see maculopapular rash in rubella. Rubella also Rotavirus may be transmitted from mother to fetus, and it causes congenital infection. It's a very severe infection if a pregnant woman is infected during the pregnancy. Rubella infection in a pregnant woman can result in serious congenital abnormalities in the child. If the mother doesn't have antibodies to rotavirus, if mother was not vaccinated or have never been infected, the virus can replicate in the placenta and spread to the fetal blood supply and throughout the fetus. Its replication observed in placenta. The most common manifestations of congenital rubella infection are cataracts, destruction of conjunctiva, mental retardation, cardiac abnormalities, and deafness. The mortality rate in utero and within the first year after birth is high for affected baby. A lot of children die if they are infected intrauterine. Maternal immunity to the virus resulting from prior exposure to or vaccination prevents spread of the virus to the fetus. So, mother must be vaccinated if she has never been infected with rotavirus. Before pregnancy, it must be done before pregnancy. In these photos, you can see complications, cataracts. This white layer, this light film on the surface of conjunctiva. Means destruction of eye cells. It is cataracts. It is disseminated rashes here and here. I have explained it. I have said about measles and about rubella. Both diseases are characterized by rashes, but these are different diseases and they are distinguished. They are caused by different viruses. What is difference? Honestly, it may be difficult to identify measles from rubella by rashes, with rashes. But if we identify, we may say the difference. In this photo, in the left photo, you can see rashes and measles, and in this photo, in rubella. If, for example, in this picture, you may see differences. Rashes in measles is more concentrated. These spots are located together with each other. I remind you that rashes in measles is caused by interaction and by destruction of blood vessel cells by CD8 cells. What about rubella? In rubella, rashes is widespread on the body. It starts from face and then spread to the body and extremities. In measles, there is another clinical manifestation. It is Koplik spots. Koplik spots appear before rashes in mouth. So we may differentiate measles from rubella by these clinical symptoms. Immunity after rubella is lifelong. Only one attack of the disease confers lifelong immunity because there is only one antigenic type. I have said about it. What about microbiological diagnosis, treatment, and prophylaxis? Sure. Rubella and measles may be diagnosed, may be identified from each other only by microbiological methods. For laboratory diagnosis, we may collect such specimens as nasopharyngeal or throat swabs and serum. We may use such methods as PCR, polymerase chain reaction, then isolation of virus in tissue cultures, and serological tests like hemagglutination inhibition test and ELISA. What about treatment? Rubella, as measles, also don't have specific antiviral drugs for treatment. Rubella is a mild self-limited illness and there is no specific treatment. If there is high fever, we may use anti-fever drugs for the child. And prophylaxis, we have said about measles, mumps, rubella vaccine, MMR vaccine. It is a combined vaccine that is used in all countries. Once more. Another pathogen that also causes viral infections is adenovirus. Morphology and structure of adenovirus. It belongs to family Adenoviridae, genera mast adenovirus. Mast adenovirus infect mammals. There is another generates avia adenovirus that infect birds, but we talk about this adenovirus that infect human. Mast adenovirus produce diseases in respiratory tract, gastrointestinal tract, and urinary tract, and in the eyes. What about features of adenovirus? Firstly, it is naked virus. We have said about influenza, parainfluenza, Rubivirus that are enveloped, and this one, Adenovirus, is a naked virus. It has no envelope. It has double stranded linear DNA. Previous viruses that we have discussed, influenza, paramyxovirus, Rubivirus, are RNA viruses, unlike adenovirus that is DNA virus. It is naked icosahedral, shape like icosahedral. Icosahedral capsid has fibers, these are fibers, and vertices. There are about 47 human serological types. Adenovirus has such antigens as A antigen, it is hexon antigen, it's present in capsid. B antigen, it is penton, pentons in the base of fiber, and C antigen, it is fiber. Adenovirus in size are smaller than other viruses, than influenza or paramyxoviruses. What about cultivation of adenovirus? Viral isolation in a cell culture requires human cells. So it may be primary human embryonic kidney cells or human epithelial cell lines such as HEP2 and HeLa. Epidemiology and pathogenesis of adenoviral infections. The source of infection are sick men. Transmission ways may be airborne, direct contact, and fecal oral. You remember that this virus causes infections in digestive system, in respiratory tract, in eyes. That's why all transmission ways are present here. Virus, adenovirus infect epithelial cells in respiratory and gastrointestinal tract, conjunctiva, and cornea. Virus persists in lymphoid tissues, in tonsils, adenoids, and pear patches. It may be served there. Pathogenesis of adenoviral infections. Incubation period is from 2 up to 14 days. Clinical syndromes. There are no specific diseases caused by adenovirus like measles, for example, caused by morbillivirus, or rubella caused by rubivirus. No. Appearance of infection depends on the site of localization of the virus, on the site of entry. So adenoviruses can cause infections of the eyes. It is epidemic keratoconjunctivitis. Then acute follicular conjunctivitis or pharyngoconjunctival fever. Eye infection appears due to direct transmission of the virus from sick person to healthy person. Adenoviruses cause infections of respiratory system like common cold that is characterized by rhinitis, then pharyngitis, tonsillitis, bronchitis, or pneumonia. It depends on localization of the virus. Genitourinary infections also may occur. It's acute hemorrhagic cystitis, inflammation of gallbladder, orchitis, or nephritis. Orchitis is inflammation of testes in men, nephritis, inflammation of kidney. And gastrointestinal infections include gastroenteritis, mesenteric adenitis, and appendicitis, that is inflammation of appendix. Fatal disease may occur in immunocompromised patient as a result of a new infection or reactivation of latent infection. So adenoviral infection is mostly dangerous for immunocompromised patients with HIV, for example. Adenovirus may be latent, may be served in adenoids and in tonsils, may be served during long period. What about immunity? Adenoviruses induce effective and long-lasting or lifelong immunity against reinfection, but it is type-specific. Type-specific. We have said that there are about 47 known serological types. Maybe there are unknown serological types that are not studied yet. That's why it's type-specific. Patient may be infected once more by adenovirus, but by another serological type. Microbiological diagnosis, treatment, and prophylaxis of adenoviral infections. Specimen includes collection of respiratory samples, conjunctiva, throat, blood, stool, or urine, depends on the site of infection. Methods that are used for diagnosis is PCR, then detection of antigen from pharyngeal and eye secretions and feces by immunofluorescence test or ELISA. I have explained about detection of antigen in influenza virus, and once more, when we collect specimen from the patient, add serum that contain antibodies labeled with fluorescein, and their bond, if antigens are present, they bond to antigens. These antibodies bond to antigens, and we can see fluorescence in microscope. The third method includes isolation of virus or its cultivation in cell culture. Cytopathic effect, or CP, includes swelling and rounding of cells. What is cytopathic effects? I have started to talk about it in previous virus. How can we understand that virus multiply in cell culture, in cell lines? We can see cytopathic effect in positive case if virus present there. Cytopathic effect may be distinguished in other viruses. In adenovirus, for adenovirus it's swelling and rounding of cells in cell culture. Serological tests are also may be used. We may observe rise in antibody titer or antibody amount. We may use hemagglutination inhibition test or complement fixation test. What about treatment and prophylaxis? There is no specific treatment for adenoviral infections. For prophylaxis, there is oral live attenuated vaccine against serotypes 4 and 7 that are widespread. And it is used in military recruits but are not used in civilian populations. Why is it used? Because actually adenoviral infections are mild infections, but if it occurs in army among soldiers, it causes epidemic there because you understand, adenovirus can be transmitted by some transmission ways, direct contact or airborne, or for example through indirect contact, and that's why it causes epidemic among soldiers, and they may be prevented by live attenuated vaccine. And the last virus that we will talk about, it is coronavirus. Some years ago we haven't talked about this virus, but this virus appeared in my lectures 2 years ago, and I hope you know why. Because of new pandemic. Coronavirus belongs to family Coronaviridae. There are some genera: alpha coronavirus, beta coronavirus, gamma coronavirus, and delta coronavirus. Alpha coronavirus and beta coronavirus infect mammals and bats. Gamma coronavirus and delta coronavirus infect birds. Which diseases are caused by coronaviruses? The first one, it is a Middle East Respiratory Syndrome related coronavirus, or MERS. Middle East Respiratory Syndrome related coronavirus. I will explain what is it when we talk about pathogenesis. The second one is severe acute respiratory syndrome coronavirus, or SARS. And the third one is COVID-19, that is also called severe acute respiratory syndrome coronavirus 19, type 2. SARS type 1 was earlier, and now it is type 2, because it also causes SARS. Features of coronavirus. Coronaviruses are spherical or pleomorphic enveloped viruses. It has single-stranded RNA. Viral protein spikes on the surface create solar corona or crown-like appearance. That's why it was named coronavirus. The viral envelope consists of a lipid bilayer where the membrane M protein is present, envelope protein, spike or S structural protein, and surface protein called hemagglutinin esterase. I will show you the diagram in next slide. Mutations in the RNA during replication of virus are common. It contributes to the appearance of new virus to be either more or less virulent. So you know that today there are some strains of coronavirus. It is structure of coronavirus. It's spherical in shape. It has RNA genome, membrane protein, envelope protein, and the most important in pathogenesis is spike or S protein. You should know that spike protein attaches to the receptor angiotensin converting enzyme 2 or ACE2 on the host cell. These structures are present on host cells and mucosal membrane of respiratory tract, and that's why spike protein provides attachment of this virus in human organism. What about cultivation? Coronaviruses are difficult to grow in routine cell cultures. They can grow only on vero cell lines. It is very difficult to cultivate them. Epidemiology and pathogenesis of coronaviral infections. Firstly, we should memorize, we should remember, we should understand that coronaviruses were known a lot of years ago, but they are distinguished in source and transmission ways. The first strain that was known, it's MERS-CoV. It appeared in 2012 in Jeddah in Saudi Arabia, and source of infection were camels and then human. Firstly, primarily, these were camels. It was transmitted by close contact between people. Firstly, people acquired the disease from animals, and just then it was spread from one person to another person, but it was rare. That's why there were just some infected person and a small amount of died people. Before it, in 20 and 2 and from up to 20 and 4, there was severe acute respiratory syndrome, SARS-CoV, that was spread in China, in Shanghai, when the source of infection were civet cats and bats, primarily, then human. It was transmitted by airborne. And the last pandemic of this infection appeared 3 years ago, students. Yes, 3 years ago. Because it almost 3 years ago. Because it was started in 29th in December, if you remember. It is called severe acute respiratory syndrome coronavirus type 2. It was type 1, it is type 2 SARS-CoV-2. It was detected firstly in China, in city Wuhan. It was in the market, in fish market, if you remember. And primary source of infection that were detected were bats and snakes, and now it's human. It's transmitted by airborne transmission or through contact transmission with object infected with excretions, with saliva or excretions from nasopharynx. Amount of infected and died people increases every day. Pathogenesis of COVID-19. You know that virus enters the human organism by airborne or direct contact. The main role in interaction of virus and human cells is in S protein or spike protein. I have said about it. This spike protein binds to ACE2. It's angiotensin cell enzyme type 2 on host cells, and that's why because of this interaction, virus enter the host cell, enter mucosal membrane of nasopharynx, for example. What are mechanisms of action? What are mechanisms of action of coronavirus in human organism after entry? The first one, coronavirus causes direct cytotoxic effect to cells. It causes direct destruction or disruption of human cells in nasopharynx and mucosal membrane. So it causes coughing, for example, runny nose sometimes. The second mechanism of its action, it is dysregulation of the RAAS. What is it? Look here. It is renin, angiotensin, aldosterone system. RAAS. You have to study it in normal physiology. RAAS is a hormone system within the body that is essential for the regulation of blood pressure and fluid balance. Comprised of 3 hormones, renin, angiotensin type 2, and aldosterone. So, coronavirus causes dysregulation of this system, dysregulation of blood pressure and fluid balance in the system by dysregulation, by disbalance of main hormones. What are results of this dysregulation? It's tissue injury in human organism, tissue injury in the lungs and bronchus, inflammation, then vasoconstriction and vascular permeability. After that, in the third stage of the disease, coronavirus causes endothelial cell damage because it's present in the bloodstream, and thromboinflammation. Coronavirus binds to, look here, the structure, it is ACE2, like here. These structures ACE2 are present in a membrane of most whole host cells. That's why coronavirus can infect any cell that has this structure. So coronavirus destroy endothelial cells, destroy blood vessels, cause endothelial inflammation, um, fibrinolysis decrease it, thrombin production increases. So you know that one of the main complication of coronavirus infection is formation of thrombin. There is blood clotting in the blood stream, blood clotting. So these clots are present in blood vessels, and it may cause stroke. It may cause stroke of the patient. Then, in this stage, what else happens? You know, I have just said that endothelial cells and blood vessels are destroyed. So this, especially blood vessels of the brain, and that's why it causes very severe headache brain. If somebody of you, I hope that most of you were infected with coronavirus, you know that it is a very severe headache, that it doesn't resemble other infections. Very severe headache. It is a severe pain in eyes because of destruction of blood vessels, and it is a loss of feeling when the patient can't feel anything. Why does it happen? Because of destruction of blood vessels, when the patient can't smell nothing, because of destruction of blood vessels in the brain, in these parts of brain that are responsible for smelling. Then another another main mechanism of coronavirus action, it is dysregulated immune response, when it causes T-cell lymphopenia, inhibits interferon signaling and hyperactive innate immunity. What is the result of it? Coronavirus causes massive cytokine release syndrome, when a lot of pro-inflammatory cytokines are produced. Interleukin 6, for example, interleukin 1, tumor necrosis factor alpha. Very severe inflammation occurs in the lungs, and it makes infection process more severe, more dangerous. That's why one of the drugs that may be used in COVID, it's anti-inflammatory drugs. Once more about pathogenesis of coronavirus. Firstly, virus enters the human organism by attachment of spike S protein with interaction ACE2 enzyme. Then it causes destruction of mucosal cells. Cytotoxic effects means destruction of mucosal cells in nasopharynx. Then it causes dysregulation of renin-angiotensin-aldosterone system that cause tissue injury, inflammation, vasoconstriction, and vascular permeability. Then it binds to endothelial cells of blood vessels, cause blood vessels in the lungs, blood vessels in the brain, so it causes headache, muscle ache, then loss of smell, and then it causes very severe inflammation by activation of cytokines, pro-inflammatory cytokines. What about microbiological diagnosis, treatment, and prophylaxis of coronavirus infection? Specimen that is collected for diagnosis includes collection of nasopharyngeal swabs and washing, straw swabs, blood, and serum. Everyone, when you travel in Russia or travel home, you know that they collected nasopharyngeal swab. It's not easy manipulation, not so fine manipulation. Methods that are used for detection, it's PCR that is used today in all the laboratories in all the hospitals. Serological tests may be used, immunofluorescence test and ELISA, and detection of antigen by ELISA method. What about treatment? Today there are antiviral drugs that inhibit viruses, that inhibit fusion of virus with host cells. This list includes such antiviral drugs as molnupiravir, nirmatrelvir, ritonavir, remdesivir, and favipiravir. They are recommended for treatment of severe patients with severe COVID-19. We also may use sotrovimab. It is neutralizing monoclonal antibody, but actually antibodies didn't find their successful using. They are not very rare use today. And relieving symptoms drugs. Relieving symptoms drugs, you will talk in other disciplines, in infectious diseases, that it is very important. Relieving symptoms drugs, it's, for example, for decrease of body temperature. Then anticoagulates must be used because you know that coronavirus causes coagulation in the blood. Then these drugs that are used for blood vessels, because blood vessels are destroyed. Antibiotics. Antibiotics, you can notice that antibiotics are not used in viral infections. They may be used if there is bacterial infection as a complication of viral infection. After coronavirus may be bacterial pneumonia. That's why it may be used. It may be used for treatment of bacterial infections. Viruses are not killed by antibiotics because antibiotics are effective just against bacteria. Every antibiotic has a target in bacterial cell. Bacteria are distinguished from viruses completely. What about prophylaxis? You know better than me that today there are a lot of vaccines that are used for prophylaxis of coronavirus. In our country, everyone should be vaccinated. No one teacher could teach in September if the teacher was not vaccinated. What about vaccines? There are some types of vaccines. The first one are RNA vaccines. You know it from immunology. You will study it in immunology. RNA vaccines contain RNA messengers that transfer genetic information about main genes. For example, it's Pfizer BioNTech and Moderna English vaccines, Britain vaccines. The second one that are most spread vaccines that are recombinant vector vaccines. It's Oxford AstraZeneca. That is also British vaccine Sputnik V. It's Russian. Covishield. It's Indian. And Johnson & Johnson, also English vaccine. And inactivated killed vaccine that contains killed viruses. It's Covaxin, that is also Indian one, and Sinopharm, it's Chinese. What about effectiveness of these vaccines? Sure, we may read a lot of scientific articles, but it is very rare. It's very early to talk about effectiveness of vaccine. We can talk it about after years. Now, that's all. Thanks for your attention. Prepare this lecture for the next